Hello, I'm Danielle Rem. I'm a student at Eastern Washington University in the Health Science degree program. I work at Spokane Valley Hospital as a phlebotomist. I work alongside many brilliant people to improve patients' health and cure illness. Some individuals I work alongside are lab technicians, and even more specifically, hematologists. I have been fortunate enough to have the aid of a hematologist and lab aide, Brian Knowles, MLS, ASCP. In my practicum, I will be reviewing skills related to hematology and teaching about the importance of this career. The goal of this practicum is to allow students to have a basic understanding of hematology, learn some of the skills, and know the importance. This will give the students an opportunity to see if this is a possible career path for them to take in the future. Unfortunately, though, I will be unable to bring students or film in the laboratory that I work at with Brian Knowles, but I will be presenting in a quiet location in the near future. In this lesson, I will start with an anticipatory set, which will be asking the students to turn to the person next to them. At this point, the students will be given 5 minutes to discuss what they already know about hematology. After 5 minutes, the students will write down at least 2 things they discussed with their partner. I will next ask students to raise their hand and tell me what they have discussed, and we will either debunk them if they're not true or learn a little bit more about them in the moment. For the modeling section of the lesson, I want to show a complete workup of a patient's blood count. I would start by showing the students first how to run the analyzer, and if and when a flag appeared, I would show them to make a proposal slide, stain it, and look at it under the microscope to ensure no errors were made by technology and to also confirm these results. After this, to show the importance of hematology, if the results warrant it, I would call the doctor to inform them. This could be anything from a critical value, suspicion of infection, or even cancerous cells. Unfortunately, again, I am unqualified to do this in the laboratory where I work, so I will be working towards a new modeling activity, or I will request that Brian Knowles assist me and maybe does the main portion of that. Like in the modeling activity, there will be use of microscopes in the guided practice. In the lecture, the students will learn about the microscope. And after learning about this learner will be asked to look at a slide with a blood smear. Next, they will be required to focus the microscope and identify what they are looking at. This would be a hands-on lesson with the teacher checking their work. Hopefully, the students would be using notes during this activity and also be very willing to ask questions. So to ensure the quality of this learning, the students will have a few opportunities to almost criticize my teaching and be tested on their own. This will be the monitor and adjust section. The students will be given a take-home case study, which would be an analyzer workup from a patient. Or in our case, it would most likely be one of the test samples that we have at the lab. Take-home case studies will be graded, and the students must find an abnormality if one is presented. I do have an example of what these look like right here. So this specific one is showing infection in the blood, and it will be simple things like that, nothing too complicated because it is just the basics. The next assignment in the monitor and adjust section will be a practice microscope sheet. This assignment consists of an unlabeled microscope printed on a piece of paper. The student should be able to label this with little to no assistance, and the assignment would be graded. Along with this, halfway through the course, a survey will be done to identify if things are working for the student or not. Students will also have plenty of opportunities to ask questions. The overall goal is for students to have a comfortable understanding of very basic hematology. The students will know the tools, why and what a CBC is, mostly why we use them, and why the hematologist is an important member of the hospital. Thank you very much for listening to my presentation. I look forward to sharing more about this practicum in the future. Thank you again.